Hello dear patients and our followers, I'm Dr. Ahmedov, hair transplant surgeon from Smile Clinic, Istanbul, Turkey. Today we are going to evaluate the case of the patient who underwent the hair transplantation surgery in our clinic almost 2 years ago, 18 months ago to be more correct. This is the 32-year-old male. He had the Norwood type 3 to Norwood type 4A of the hair loss, meaning the loss of the continuity of the front hairline, open area in the both temples, receding and thinning in the front mid part, front forelock, and front third of the head. When we evaluate the patients for the hair restoration surgery, the first thing we do, we stage their hair loss. And as we usually tell, we use the Norwood scale for this purpose. On Norwood scale, the male pattern baldness goes from stage 2 to stage 7. 2 meaning the least, 7 meaning the most of the hair loss. Norwood type 1 means no hair loss in the regular hair. For Norwood type 3 to Norwood type 4A of the hair loss, on average we may need the numbers varying between 3 to 4,000 grafts. Of course, numbers change from patient to patient depending on the size of the open area, the density you want to get, expectation of the patient, but the most important criteria here is the capacity or ability of the donor area. And because the Norwood type 3 and Norwood type 4A of the hair loss are the early stage of the hair loss, most of the time single surgery give really good results, really life-changing appearance to the patients. You can see the patient here, he had a very prominent receding, especially on the both temples. They are slightly asymmetric. One side has receded slightly more than the other side, and it's very unique, and we see it very frequently with the androgenetic or male pattern baldness. You can see the main problem was in the both temples, right, left, some thinning in the front forelock or front tuft of the hair. The front forelock or front tuft of the hair that circle in the mid is a very important side during the hair restoration surgery. It gives up to the 35 to 40% of the volume in the front side, so we pay particular attention so the density becomes good here as well. Because the number of the grafts we need for this surgery is not very high, most of the time for the early stage of the hair loss, we try to go with the conservative hair transplantation surgery. What does it mean? It means that in a classic FUE technique, we first do the extraction, then incision, and then implantation. So we take the hair, prepare new slots or new channels for them, and then put them back or implant them. Conservative hair transplantation surgery, the first thing we do is we do the incisions. According to the number of incisions, we do the extraction from the donor area. This way, we try to protect it as much as possible. So the patient was reconstructed the front hairline. There are some criteria for the reconstruction of the front hairline. It's the age of the patient, face anatomy, capacity of the donor area, the active stage of the hair loss. So you have to pay attention to many criteria. So the hairline becomes natural, stays actual with the age as well, because as we know, as we men get older all the time, our hairline recedes more to the back. This is called the maturation of the hairline, and it should match the age of the patient as well. The hairline was drawn, the areas that needs to be transplanted, marked. The highest priority, as we have talked, was the two temples, right, left, the front third, and reinforced on the front forelock. The patient, first we did 2,850 incisions and took 2,850 grafts from the donor area, spread it evenly all across the back. The grafts were placed in a specific order and direction, so they give a more better outlook of the hair. And here you can see the results of the patient at 9 months. You can see the hairline is very well redefined. One of the main criteria for the correct hair transplantation surgery is this angle. We sometimes call the frontotemporal angle, and you can see it goes slightly high and goes down the almost like 90-degree angle that gives a much more natural outlook for the patient. The front forelock was reinforced, so you can see it's a natural outlook in the hair, like we restored back the hairline the patient had. As I mentioned earlier, early stage of the hair loss are really good surgeries when done correctly with a good planning. One of the main questions we get from the patients that want to come for the hair transplantation surgery, there is a very big misconception. People saying, hey, let me lose as much as we can and then I'll come and cover everything. But it's a wrong approach. We tell the patients at first, if it's a very early stage, the medical treatment is the key. But if you have already gone to the stage 2 or stage 4 of the hair loss, the surgery is already a must for you. With the surgery, we try to cover the open areas, but after the surgery, again, we try to put the patient on medical treatment because it's like playing with a puzzle. With the hair transplantation surgery, we cover the open areas as much as possible, but the medical treatment is very critical to prevent further loss of your non-transplanted or pre-existing hair. So this is one of the examples of the really life-changing good results with the minimum number of the grafts with the early stage of the hair loss. If you have any questions left, you can put them or message them underneath this video. We'll be glad to answer them. Stay tuned and good luck.